Good afternoon, and welcome to the Mid-America Regional Council's Local Officials Briefing for Friday, May 1st. Today, we'll take a look at the current situation and see what's happened over the past week. I'm Mike Parker. I'll be presenting today on behalf of the Mid-America Regional Council. Should you have any questions during the briefing, please add them to the comments section of the video, and we will do our best to respond in a future briefing. The common operating picture. The KC Region COVID-19 Resource Hub is now publicly available at preparemetrokc.org. The Resource Hub is updated daily with the most current information on COVID-19 cases, tests, and deaths as reported by the 9 counties in our region and Kansas City, Missouri. Our source for forecasts is the Institute for Health Metrics and Evaluation, the IHME, at the University of Washington in Seattle. This is the best information available today. The situation can rapidly change. Based on current projections, the peak of infection and resource requirements for the state of Kansas was April 30th. Given the uncertainty of forecasts, the IHME also provides a range of peak resource use, which is April 9th to May 10th. The peak death rate in Kansas is forecast for May 3rd. The IHME containment strategy for Kansas is June 29th. That is the date when relaxing social distancing may be possible with containment strategies that include testing, contact tracing, isolation, and limiting gathering size. Based on current projections, the peak of infection and resource requirements for the state of Missouri was April 22nd. Given the uncertainty of forecasts, the IHME also provides a range of peak resource use, which is April 22nd to May 8th. The peak death rate in Missouri was forecast for April 27th. The IHME containment strategy for Missouri is not available. Today, there are 2,376 confirmed cases of COVID-19 in the region and 135 deaths. This represents an increase of 421 cases and 16 deaths over the past week. The number of people tested in the region rose to 10,222. But numbers are incomplete since not all counties are reporting. This represents an increase of 2,433 people tested over the past week. On Tuesday, April 28th, the Multi-Agency Coordination Group met to discuss our collaborative efforts now and into the future. The MAC group is a multidiscipline, multi-jurisdictional representative group that is organized to improve communication across the 9-county region. Members of the group discuss local phasing plans for relaxing stay-at-home orders. The MAC group will meet again on Tuesday, May 5th, to discuss areas of alignment among these plans to help with regional public messaging. Public notices for MACG meetings are available on the public meeting calendar on the MARC website at www.marc.org. Strategies for recovery and reopening were announced by Governor Parson and Governor Kelly. In Missouri on April 27th, Governor Parson announced the first phase of the Show Me Strong Recovery Plan, outlining how Missouri will gradually begin to reopen economic and social activity on Monday, May 4th. In Kansas on April 30th, Governor Kelly outlined the next steps for coronavirus efforts in Kansas. The administration posted a new framework for transitioning from the response plan to the recovery phase of this crisis. Within the region, jurisdictions are crafting plans that meet the needs of people and businesses. Johnson County and Wyandotte County in Kansas, and Kansas City, Clay County, and Platte County in Missouri all announced plans for relaxing physical distancing and reopening businesses. MARC is compiling a summary of these plans to identify areas of alignment to assist with regional public messaging. Public health, business, and political leaders will monitor progress to assess what works and what needs their attention. The way forward will be guided by 3 factors or gating criteria: symptoms, cases, and hospitals, and then how each of these trend over 14-day periods. These strategic objectives remain unchanged and are the focus of the work of the Multi-Agency Coordination Group. In addition to these objectives, we maintain the capability to respond to other events that threaten lives and property. The status of all 7 lifelines in the region is green. but all are hampered by a shortage of personal protective equipment, PPE, where the consumption rate is still exceeding the supply rate throughout the region. Otherwise, all lifelines are functioning as required with no mission-critical shortages of personnel, equipment, or supplies forecast for the next 48 hours. The weather forecast for the next 48 should not have any impact on our response operations. Now, I will provide a brief update on supporting functions and disciplines. ESF 8, Public Health and Medical Services. The MARC Healthcare Coalition continues to assist EMS and healthcare organizations in requesting personal protective equipment, PPE, from the Missouri Department of Health and Human Services and through the Strategic National Stockpile. The Healthcare Coalition is continuing to prioritize hospitals, long-term care, and EMS for the PPE. Since this process started, there have been well over 500 requests from our area, and the region has received 67,000 face shields, 19,000 gowns, and nearly 500,000 N95 standard procedure masks. Regional local public health agencies received additional testing supplies to provide greater capacity to facilitate public testing for higher risk groups, such as vulnerable populations, long-term care residents, or first responders who are asymptomatic. ESF 6, Mass Care, Emergency Assistance, Temporary Housing, and Human Services. Multiple jurisdictions are working with nonprofit organizations to conduct feeding operations and to provide temporary shelter for vulnerable populations. Harvest Church conducted food distribution on Thursday, April 30th at Old Indian Springs Shopping Center. Planning efforts are underway for a similar operation at Arrowhead on Monday, May 4th. ESF 7 Resources Support. The ESF 7 section continues to work with MARC staff on a personal protective equipment cooperative purchasing effort through the Kansas City Regional Purchasing Cooperative. The cooperative contracts for 7 PPE vendors have been signed and should be posted today. Missouri and Kansas have received Battelle Critical Care Decontamination Systems. This system uses vapor phase hydrogen peroxide to decontaminate N95 masks. The system will be operational in approximately 4 to 6 days and has the capacity to decontaminate 80,000 N95 masks at full capacity. The system will be available to all healthcare providers and first responder organizations who use N95 masks. ESF 14, Long-Term Recovery. The Greater Kansas City Chamber of Commerce, Kansas City Area Development Council, Kansas City Civic Council, and MARC hosted a town hall meeting on Wednesday to share the Safe Return Guide, a tool for local businesses as they navigate the new environment. Nearly 700 guests participated in the webinar. The Safe Return Guide is available at www.preparemetrokc.org. In addition, the KC Chamber Return to Work Business Summit Help Desk operates Monday through Friday, 8:30 a.m. to 5 p.m. This week, the MARC also partnered with the Institute for Building Technology and Safety, IBTS, to provide a free webinar about the process for accessing FEMA public assistance funding. This session is ideal for communities who do not have extensive experience with reimbursement process through FEMA and state agencies. A recording is available at www.preparemetrokc.org. ESF 15, Emergency Public Communications. Because of your social distancing efforts, we are flattening the curve in the metro. Thank you. The stay-at-home orders are now transitioning to local jurisdictional recovery plans to allow for the safe reopening of our communities. How quickly and effectively our community can reopen is directly related to the spread of COVID-19, which depends on the community's response. When all rules and guidance in each step are followed, the likelihood of a more rapid reopening occurs. When rules or guidance are not followed, the reopening process is likely to take significantly longer. The end of stay-at-home orders are not a return to normal. Returning to normal will take a long time. There may be several relaxing and tightening of stay-at-home restrictions in our future. Social distancing requirements, protective masks, and cleaning protocols are critical to slowing this disease. These practices will need to continue into the foreseeable future. Wearing masks in public is highly encouraged. The hashtag SafeReturnKC Guide is a regional resource to help guide your business on how to bring back your workforce safely. Here's a guide to MARC's presence on the web. Take the time to visit each of these for more updated information. In closing, we remind you that we are posting these periodic briefings at the Prepare Metro KC YouTube channel. Please subscribe to the channel and sign up for alerts to receive notification of future briefings. We will monitor comments posted to the briefing videos for questions that we can answer in future briefings. And remember the hashtag StayAtHomeKC message. Stay safe, protect us so we can protect you. Stay strong, be informed, be positive. Stay home. It takes all of us to get through this together. Thank you for your attention. This concludes our briefing.